The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name is Mark Ryan, and it's a pleasure to be hosting the podcast, and thanks to everyone for listening in. We are in the part 3 of my deep dive into healthcare reform. So I wanted to give you a little bit about the blogs I wrote about healthcare reform and the deep dives, and then summarize the podcasts about healthcare reform and the deep dives. At the blog tab on healthcarelabyrinth.com, I published my healthcare reform proposal on May 27th in a blog. And then on June 10th, June 13th, and June 17th, I did deep dives into the 3 main tenets. On June 10th, I discussed price reform. On June 13th, I talked about pivoting from our obsession with utilization management to care management and population health. And on 6/17, I talked about affordable universal access. So as you can imagine, those 3 tenets, price reform, pivoting to care management and population health, and affordable universal access are sort of my main components here. A similar series on the podcast also occurred. On June 14th, I summarized my healthcare reform proposal. On June 21st, I talked about price reform in detail. On June 28th, I talked about pivoting to care management in detail. And today, on July 5th, we're closing out the podcast series on healthcare reform with affordable universal access. So we hope you've been enjoying the series, and we'll get right to it here. So as I often talk about in terms of affordable universal access, I talk a little bit about the 3 main systems that in the developed world, and they are socialized medicine, single payer, and private affordable universal access. And the United States, as I often talk about, is about the only country that doesn't have one of those form and guarantee affordable universal access to every citizen. Every other developed nation pretty much does that. And as a consequence, the uninsured rate in these other developed countries is just on average about 1%. So pretty much universal access for all of these developed countries. Here in the United States, we have a much different system. We don't guarantee affordable universal access. While we have private health care, it is very fragmented and it's very expensive. And health products, again, sometimes are very unaffordable. I think of about 85 million people, about 25% or a quarter of the population, that is either uninsured or underinsured. That uninsured number, I place between 25 and 30 million people or so. And then the underinsured is about 55 million people, so about 85 million people. And this is a huge problem. And consequently, we have 8 to 10 uninsured rate. If you include the underinsured, we have 25% of people that aren't covered or can't really afford to use their coverage, compared to about 1% uninsured rate and really good affordability for the most part in every other developed country. So we need affordable universal access to achieve lower cost. We know that our cost, if you look at the OECD average of nations, is about 80% greater than healthcare costs in the OECD nations on average. 80%. That's huge. And so in order to achieve savings and also to get better quality, we have abysmal quality. We're dead last in these rankings of developed world countries. We need to have affordable universal access. So why is it so important? Well, it's really quite simple, right? When you do not have access to healthcare or affordable access to healthcare, you tend not to take care of yourself or have wellness and prevention or even can afford to keep your disease states in check. And consequently, what occurs in America is these 25% of people basically use the emergency room and inpatient hospital settings for their health care for the most part. Extremely expensive places of service, which is a real big problem. If they did have consistent, affordable access to coverage, they could afford to go to a primary care physician, get preventative screenings, and hopefully keep their disease states in check through medication and regularly visiting both the primary care physician and potentially even specialists out there. So that is sort of quite simply why affordable universal access is a key tenet of my healthcare reform proposal. Let's dig a little deeper into some of these issues related to affordable universal access. But at first, I wanted to give you a story before our first break. And the reason I'm giving you this story will become much more apparent by the end of the podcast. I want to tell you a little bit about one of my favorite presidents, Teddy Roosevelt. I'm a Republican, but a little bit atypical, and in some ways, I probably look a little bit like Teddy Roosevelt. So, as many of you know, Teddy Roosevelt served as president from 1901 to early 1909. He became president after the assassination of William McKinley in 1901. What most people don't know is that it was Teddy Roosevelt who became the youngest president ever, not John Kennedy, believe it or not. John Kennedy was the youngest person elected to office and then became president, but Teddy Roosevelt was actually younger than him when he took office as the vice president of William McKinley after McKinley's assassination. And a couple of interesting things I like about Teddy Roosevelt is, number one, from a free market standpoint, he believed in the free market, but he was also a trust buster. And a trust buster president went about basically breaking up monopolies and oligopolies and things like that that were at the time in the United States to ensure better competition and actually, frankly, lower costs. So he's a big believer in the free market, but he did not believe in monopolies and allowing a lack of competition in the economy. And in many ways, that's what we see today in our healthcare system. We have too few health plans. We have too few hospitals. We have too few provider group entities. And because these entities have all consolidated, we very much have a bit of a lack of competition out there. One of the reasons I applaud the Biden administration to better scrutinizing these kind of acquisitions and mergers and things like that. So number one, I like Teddy Roosevelt because he was a trust buster. I'm also a follower of foreign affairs, and Teddy Roosevelt really enhanced the United States image on the world stage. He actually won a Nobel Peace Prize for negotiating an end to the Russo-Japanese War early in the 20th century. And he also had something called the Roosevelt Corollary to the Monroe Doctrine. And the Monroe Doctrine back in the early 1800s under James Monroe basically put other nations on notice that we deemed the Western Hemisphere as something that we should control and not have foreign influence in the hemisphere. Well, Teddy Roosevelt, about 100 years later, roughly, had the Roosevelt Corollary and pretty much sort of paralleled Monroe's views on the Western Hemisphere and the fact that America should have great ability to influence policies and things in the Western Hemisphere without other foreign interference. Thirdly, here, I would tell you I admire Teddy Roosevelt because he was a conservationist. Republican, yes. Believed in the free market, yes. But he also cherished the American lands and felt that we needed to preserve them for the future. And that's actually an admirable goal. I think everyone believes in conservation, notwithstanding some of the more volatile climate change control politics of the day. Lastly, Teddy Roosevelt, believe it or not, was a believer in affordable universal access. This comes from a Republican, which is very interesting that a Republican would champion this type of issue. Most of his advocacy for affordable universal access came after he had left office. Again, he served out the remainder of the presidential term from 1900 to 1904. McKinley was in there in part of 1901. Then Roosevelt came in and basically served almost the entirety of McKinley's second term, Roosevelt's first term. Roosevelt ran for re-election in 1904 and won, so he served until early 1909. Teddy Roosevelt was known to get a little bit anxious, and so he decided in to not run again after he served through 1909. William Howard Taft became the president, having won in 1908, because Roosevelt didn't run. And Teddy Roosevelt goes off and goes on an African safari. He actually came back during Taft's term, and he went and told Taft that he wants to be president again and he wants to run in 1912. Well, although Taft never really wanted to be president, he was not about to give up the presidency at that point, and he said he was running in 1912. What did Roosevelt do? Well, Roosevelt mounted an independent third-party campaign that year in 1912. Taft was the GOP nominee. Wilson was the Democratic nominee. And Teddy Roosevelt ran as a progressive Bull Moose Party candidate. What happened was Taft and Roosevelt split the vote, and Wilson came in as a minority president to serve from 1913 to early 1921. What's interesting about Roosevelt's run as a third-party candidate, though, was the fact that he essentially put affordable universal access into his platform for the progressive Bull Moose Party. In his new nationalism speech on August 31st, 1910, Roosevelt said, quote, "Let me add that the health and vitality of our people are at least as well worth conserving as their forests, waters, lands, and minerals. And in this great work, the national government must bear a most important part." So again, Teddy Roosevelt essentially endorsing affordable universal access. While he's a third-party candidate, he's still a Republican at heart, which I think is interesting because very few Republicans hold that kind of position. With that, we'll take our first break.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this edition of the Healthcare Labyrinth podcast. So we just concluded with telling you a little bit about Teddy Roosevelt's endorsement of universal access to healthcare coverage back in his 1912 Bull Moose Party run. It obviously ended in failure because the Republican vote, as I noticed, was split, and Woodrow Wilson was ushered in as president. Let's now get to some of the key aspects of my proposal on affordable universal access. So we talked about three different types of systems, and given private delivery success in other developed nations in terms of being cost efficient as well as quality oriented with affordable universal access, I propose that the United States adopt a system rooted in private affordable universal access. Private plans would run the healthcare system with regulatory direction from the Centers for Medicare and Medicaid Services and other state and federal agencies. I think this rubric where government, primarily through CMS, overseeing regulation and accountability of private healthcare, and private healthcare being innovative and innovating in delivery of the care and delivery within the system, to me, is a very good match. And I think it makes a great deal of sense because it leverages government's role in regulation and the private sector's role in innovating in terms of delivering in a cost-effective and quality way. I think CMS should take that lead in most areas to ensure coordination across what would be a much fewer lines of business now. So states might still have a role, and there might be some role for the Department of Labor under, employer coverage, but basically CMS would be the main overseer of healthcare accountability and regulation. While this would be a bit of a burden on business, I believe we should continue with our employer-sponsored coverage foundation. This is so for a few reasons. First, if we did enact price reform, it would help reduce costs for business and end the cost shifting that occurs from Medicare and Medicaid to the employer coverage world. That would also make coverage more affordable and reduce businesses' costs dramatically. Number two, employer coverage is also reasonably popular among Americans. They actually tend to like the connection to the employer. And last, a bit of my pragmatism, ripping employer coverage apart would mean huge upheaval in the system as a whole. And I'm just not sure if that's worth it. The problem with the proposal is that there is still a solid percentage of Americans, I say about 25%, which is the number of uninsured and underinsured, that do not have a consistent or strong nexus to employer coverage. So who are these people? Well, they're the elderly or the disabled who do not work. Some go in and out of the job market and don't have that consistent coverage to healthcare in the employer world. Some have low incomes and cannot afford premiums and cost sharing. As such, to solve this problem, I would propose that we create one master safety net healthcare program that serves all these disenfranchised folks. The system would have sliding scale premiums and cost sharing subsidies. For lower income families, the subsidies could be used either for employer coverage or the safety net program. It's their choice. I am open to maintaining the Medicare program side by side with this system given the sicker cohort the program serves and its complexity. But a case can also be made that the single social safety net program would be most stable with all remaining non-employer populations in it. The One Master Social Safety Net program could be sponsored by the federal government or be a state-federal partnership like Medicaid and some of the exchanges. The traditional fee-for-service Medicaid and Medicare systems would go away in favor of a private delivery model, as we have in Medicaid managed care and Medicare Advantage today. Most Affordable Care Act protections would stay in place, including community rating, pre-existing condition protections in terms of not only getting insurance, but also having those conditions covered when you get that insurance. Preventative services would also be present. and that would be maintained from the ACA protections. And benefit mandates would also be part of the new system. I would propose to modify the generosity of some of those benefit mandates, however. In more rural areas where private delivery of healthcare is a little more difficult, rate-based participation incentives similar to what is in MA today, as well as reinsurance and rate corridor programs like occurred in the exchanges, would be put in place. Fair risk-adjusted rates would also be a cornerstone of this one single social safety net healthcare program. Employer and individual mandates would exist, and tax credits would also exist for small businesses so they could afford to provide employer-based coverage. What would be accomplished if my proposal is adopted? Well, we would finally have affordable universal access that prioritizes coverage. Coverage will eventually reduce costs in the system as people move to less costly healthcare interventions, as opposed to crisis inpatient and emergency room services. We would conquer the issue of the uninsured, but as well the underinsured problem too. Combined, again, these total about 85 million or 25% of the population, so that's a worthy accomplishment too. We would eliminate tremendous duplication and administrative costs in the healthcare system. This clearly costs us tens of billions of dollars per year, if not more. My proposals on price reform could be more easily implemented if we did this. And with better and more stable coverage for all, the shift from utilization to care management could actually be made more successful too. With that, we'll take our second break, and we'll come back to discuss a little more about my healthcare reform proposal and get back to why I mentioned Teddy Roosevelt in the beginning.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back. We hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about affordable universal access as one of my three tenets of my healthcare reform proposal. So we've sort of given you my outline of healthcare reform. And one question I have, does it sound familiar? And if it does, in fact, some of my proposals mirror various historic proposals out there, including Romney Care by Mitt Romney when he was governor of Massachusetts, Hillary Care, the failed reform process by Hillary Clinton when her husband was president, and of course, Obamacare, the Affordable Care Act. So you'll see some of those elements in my proposal. But the proposal has most in common with a proposal by President Richard Nixon back in the 1970s, another Republican. You could very well say I cribbed a bit from Nixon here. Nixon was actually somewhat of a trailblazer on healthcare, including supporting and ushering in the HMO Act of 1973. While we still have major problems, the HMO Act brought about managed care as an alternative to a strictly fee-for-service transactional environment. So we owe Nixon a great debt of gratitude there. But more importantly, Nixon in early 1974 did propose a universal health care access proposal. He had proposed a partial remake of health care as well back in 1971. It would have mandated employers provide health insurance, and it would have started federal affordability subsidies for workers. But that didn't really go any place back in 1971. And so Nixon really wanted, after the HMO Act of 1973 passed, to put his mark further on healthcare by proposing universal healthcare access in early 1974. Sadly, the Watergate scandal forced Nixon to resign in August of 1974, which effectively killed any chances for his plan to pass. What I find fascinating about Nixon's healthcare proposal is his compassion for the less fortunate, which is not unlike that of another Republican president, Teddy Roosevelt, who we talked about earlier in the podcast when he was running in 1912 as the third-party Bull Moose progressive candidate. But anyway, Nixon's proposal would have continued employer-sponsored coverage. It would have mandated various forms of coverage in the United States. It would set up that one single social safety net program that anybody who wasn't in employer coverage would go into. And again, it would have reduced complexity rather dramatically. Again, I really credit Richard Nixon for his proposal, even though it didn't go anywhere. He would be the second Republican president that proposed comprehensive reform of coverage and endorsed affordable universal access. I would throw a third Republican president in the mix here. While it was not comprehensive healthcare reform and affordable universal access, President George W. Bush actually endorsed and helped create the Medicare Part D program that is so important to seniors and the disabled, because before that act passed, the Part D retail drug program, there was really no drug program for seniors, and it was a huge problem. I would encourage you to search on the internet for Richard Nixon's special message to Congress on his healthcare reform proposal. Again, it's pretty simple. All you really need to do is search Nixon's special message to Congress on healthcare, February 6th, 1974, and you should be able to find it pretty quickly there. When you do read it, please note a couple of things. Number one, note the references to high prices and major inflation even back in 1974. Note his discussion on a segment of the population that is disenfranchised from health care. Note the concern about the lack of comprehensive coverage and how people are actually underinsured. I'd like to just do a couple of quick quotes from the special message in case you're not able to go and search for it. Nixon said, quote, "One of the most cherished goals of our democracy is to assure every American an equal opportunity to lead a full and productive life." Sounds a bit like Teddy Roosevelt there, I would say. Next, quote, "Without adequate health care, no one can make full use of his or her talents and opportunities. It is thus just as important that economic, racial, and social barriers not stand in the way of good health care as it is to eliminate those barriers to a good education and a good job." Quote, "Today, the need is even more pressing because of the higher costs of medical care. Efforts to control medical costs under the new economic policy have been met with encouraging success, sharply reducing the rate of inflation for healthcare. Nevertheless, the overall cost of healthcare has still risen by more than 20% in the last 2.5 years. So that more and more Americans face staggering bills when they receive medical help today." And one last quote really talks about gaps in healthcare. He says, quote, "These gaps in health protection can have tragic consequences. They can cause people to delay seeking medical attention until it is too late. Then a medical crisis ensues, followed by huge medical bills or worse. Delays in treatment can end in death or lifelong disability." So there you have it. Richard Nixon, a pretty no-holds-barred individual that has shown great compassion for his fellow man and wanted to tackle the problem of uninsurance and underinsurance by offering affordable universal access. Even then, Nixon saw what was going on in healthcare as a crisis. Here's hoping the time has come for healthcare reform some 50 years later. Here's hoping the healthcare views of the two GOP presidents I quoted here can rub off on some members of my very own party. With that, we'll conclude this edition of the Healthcare Labyrinth podcast, and we'll see you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.